Mpox is a disease caused by a virus. It used to be called monkeypox. The virus is related to smallpox, but milder. It can infect people too. Symptoms include fever, swollen lymph nodes, and a rash. Most people recover fully. The recent increase in cases worldwide is concerning. More awareness and research are needed. Mpox spreads through close contact with an infected person or animal. You can get infected by touching the Mpox rash, bodily fluids, or scabs. This can happen during intimate contact, including sexual contact. Sharing contaminated materials like bedding or clothing can also spread the virus. Less commonly, Mpox can spread through respiratory droplets. This requires prolonged face-to-face contact with an infected person. Pregnant women can transmit the virus to their unborn babies. It's important to remember that Mpox is not solely a sexually transmitted infection. It spreads through various forms of close contact. Avoiding contact with infected individuals and animals is crucial. Practicing good hygiene, such as regular hand washing, is also essential. Vaccination is available for those at risk and is an effective way to prevent Mpox. Mpox symptoms usually appear within 1 to 3 weeks after exposure. The initial symptoms resemble the flu. These include fever, headache, muscle aches, back pain, and swollen lymph nodes. You might also experience chills and exhaustion. A rash typically develops 1 to 3 days after the flu-like symptoms. It often starts on the face and then spreads to other body parts. The rash goes through different stages. It starts as flat spots, then progresses to raised bumps. These bumps turn into fluid-filled blisters, which eventually crust over and fall off. Not everyone experiences the same progression of symptoms. Some may develop the rash before other symptoms. Others might have a limited rash in a specific area. It's important to be aware of the various Mpox presentations. If you suspect you might have Mpox, seek immediate medical attention. Section 4. Diagnosis and treatment of Mpox. Diagnosing Mpox involves a combination of clinical evaluation and laboratory testing. Doctors will consider your symptoms, medical history, and potential exposure to the virus. However, confirmation requires laboratory tests. These tests detect the virus's DNA in samples taken from skin lesions. Treatment for Mpox mainly focuses on managing symptoms and preventing complications. This may involve pain relief, wound care, and medications for specific symptoms like fever or itching. Antiviral medications, initially developed for smallpox, show promise in treating Mpox. Doctors might consider these medications in severe cases. Vaccination is a crucial tool for preventing Mpox infection. Older smallpox vaccines offer some protection against Mpox. Newer vaccines specifically designed for Mpox are also available and highly effective. Vaccination is recommended for healthcare workers and those in close contact with infected individuals. Section 5. Protecting yourself and others. Preventing Mpox requires a multi-pronged approach. First and foremost, avoid close contact with infected individuals and animals. Practice good hygiene by washing your hands frequently with soap and water. Use alcohol-based hand sanitizers if soap and water aren't available. Avoid contact with materials that may have been contaminated with the virus, such as bedding or clothing. If you have any cuts or sores on your skin, keep them covered to prevent potential infection. Vaccination is a powerful tool in the fight against Mpox. If you are at risk of exposure, consult with your healthcare provider about getting vaccinated. Raising awareness about Mpox is crucial. Share accurate information about the virus, its transmission, and prevention methods with your family and friends. By working together, we can limit the spread of Mpox and protect our communities. Section 6. The global fight against Mpox. The recent Mpox outbreak highlights the importance of global health security. The WHO coordinates the global response, providing guidance on surveillance, testing, and risk communication. They emphasize awareness, vaccination, and preventive measures. Countries must share information, resources, and expertise. Continued research and development of vaccines and treatments are essential. The fight against Mpox requires a collective effort.